Well, Dr. Asandra, walk us through this. Tell us exactly what the treatment entails.
The best way that I like to replace hormones is with bioidentical pellet therapy. And this usually consists of testosterone or estrogen. It's a simple procedure that we do. We just numb up the area in the upper hip or the buttock area, make a tiny little incision, use a special tool, and then insert the pellets. The dosage is based upon the patient's need, and et cetera. And then these pellets last about 3 to 4 months with a constant 24-hour physiological release. I don't need to see them for about 3 or 4 months. And during that time, we also check their blood work to see how well the pellets are working and if we need to make any adjustments on the subsequent ones.
But like any treatment, this isn't without risk. So can you talk about some of the possible complications?
Yeah, so when your hormone levels are too low, and women as they age, they're at higher risk for osteoporosis. They lose muscle mass, and it can be very unhealthy to the body. But again, if we put too much estrogen in, they can have side effects with that as well. They can have some vaginal bleeding, the breast can enlarge, they may store a little bit more fat. If we put too much testosterone, we can have something called virilization effects, which they become more manly, if you will. Get the hair growth, the acne, the clitoral enlargement, and then the libido can sometimes go even too high for that. And that's why it's so important to monitor, and we check their blood work at least 4 times a year. I never start anybody on a high dose. I'm very conservative when I start. Just start them with, a mild to moderate amount, and then make the adjustments as the year goes on, based on their blood work, but also based on their activity level, because sometimes women may lose weight and they may have changed their activity level when they get the pellets. So it's very important that we monitor this and then make the appropriate adjustments.
All right, Karen, after your own personal journey here, what advice do you have for other women?
Well, I never ever thought I would be on television talking about this, but I feel so good that I just want to share the news. I literally called everybody on our staff and was like, I want to talk about this on the show, because I had.
Well, there you go. Here you are.
So it's like, every woman is going to go through this. Your symptoms will be different, but there is help, and you don't have to suffer. And I think that, there are things you just take control and try to, it's just get help, I guess.
And Dr. Nita, unfortunately, I think a lot of women suffer and go through this and choose not to do anything about it. Is that what you find to be true?
Yeah, it's one of those things where the symptoms of menopause or the menopause transition, they won't kill you, but they sure will suck a lot of joy out of your life. And we want women to live fulfilling lives, and we want them to be happy. So I would definitely say make sure you're talking to your healthcare provider. There are options out there. You don't need to suffer. Just talk to your doctor, but make sure you're talking to someone who knows what they're doing and someone who will make sure that you're staying safe when you're using hormones.
All right, Karen. So happy to see you're doing so well. And clearly, Dr. Asandra, this is what you do. You are on it, and you have one happy patient. Thanks for being with us today.
Thank you guys for having me.